Good evening, and thank all of you for being here today. We just finished our second Unified Command Group meeting concerning the novel coronavirus, also known as COVID-19. In addition to myself, you're going to hear in a few minutes from Assistant Secretary of the Office of Public Health, Dr. Alex Biu, and obviously we have several statewide elected officials and various secretaries of different agencies who will be here along with myself, and able to take your questions at the conclusion of our prepared remarks. And I do want to thank all of them for being here today. The first thing that I want to announce is that this afternoon I signed an executive order declaring a public health emergency for the state of Louisiana. This declaration ensures that state resources are made available to our state agencies and local governments. It addresses issues including price gouging, should that become necessary, as well as prohibiting international travel for state employees to level 2 and level 3 countries as designated by the CDC. These guidelines were developed and recommended by the COVID-19 task force that I stood up some time back. We can now confirm that there are 13 presumptive positive cases of COVID-19 in Louisiana. The 7 latest presumptive positive results were reported by the Department of Health this afternoon. And at this point, the impacted parishes are Orleans, Jefferson, St. Tammany, Iberia, Lafourche, and Caddo. And we are fairly certain now that there is community spread in the Orleans area. And that is based on the fact that we've done enough epidemiological investigation and contact tracing that these individuals are not contracting this infection by travel. They're not, and we can't identify any individuals that they contacted, and therefore, by definition, we now believe we have community spread in that area. While the majority of current patients are hospitalized, the reality is that not everyone who tests positive will need to be hospitalized, and some will be able to self-isolate at home. The numbers are going to be changing frequently. We do expect the number of confirmed cases to increase over time. That's been the experience elsewhere around the world, and in the United States is what we've been told to expect from CDC as well. Starting tomorrow, LDH will be updating presumptive positives and other relevant information twice daily at 9 a.m. and 4:30 p.m. on ldh.la.gov/coronavirus. That's ldh.la.gov/coronavirus. As more cases are confirmed, we need people, obviously, to stay calm. The risk is still low for any individual to develop COVID-19. Obviously, the risk to the community at large is increased beyond what it was yesterday and the day before. But the most important thing that people can do is to take appropriate precautions, because at some point the number of cases of COVID-19 will peak. And the duration of this event will be known. It's obvious that what we're trying to do is make sure the peak occurs as low as possible and that the duration of the event slows so that the demand on our healthcare providers is not all at one time. And so this gets back to the very things that we've been talking about all along, the precautions that I am imploring everyone in Louisiana to take very seriously. This includes frequent hand washing, avoiding close contact with others, covering your cough appropriately with the crook of your arm if necessary, and staying home if you are sick. We still know that the elderly and those with chronic health conditions are at the greatest risk. The best thing they can do is certainly stay away from individuals who are sick, stay away from large gatherings, and reconsidering any travel plans that they have. Certainly not traveling unless absolutely necessary on an airplane, and then they should not get on a cruise. We know that you are all aware that Lambeth House in New Orleans put out a public notice today identifying that one of the state's presumptive positive cases is a resident at Lambeth House. We can now update you based on more recent testing concluded this afternoon that 3 residents total now are presumptively positive from Lambeth House, which is a facility that is a combination of assisted living and also a nursing home. They are doing exactly what we would hope they would, which is taking all the necessary precautions and actions to protect their residents. They are doing that in close consultation with the Office of Public Health, but also the officials there in Orleans Parish as well. And we also have the Nursing Home Association that is working this issue and facilities all around the state to advise their facilities and individuals to make sure that they take advantage of alternative ways to check in on their loved ones. The extent to which we can decrease the number of visitors who are going to nursing homes, assisted living centers, that will really help control the spread of this particular coronavirus. I think it's fair to say, and you've seen some of this from local officials already, and you've also seen some decisions being announced by entities like the NCAA, that over the coming days and weeks there will be a number of cancellations. Sometimes the events won't be canceled, but it will be changed not to allow spectators, which is what we've been told will happen with respect to the March Madness events, including the women's Final Four in New Orleans. But as facts become known and the situation changes, you're going to see announcements made, and I would hope that the people of Louisiana understand these choices are tough, but they're going to be made in consultation with guidance we're receiving from CDC, talking to the Office of Public Health, and certainly with local governments as to what the current situation is at any given time. These cancellations are being done with the public's health and safety in mind, and it's always the case that the health and safety of the public is our number one concern. We obviously want everyone to be healthy. I know that if we will take care of ourselves now, in the future we're going to go back to enjoying things as normal here in Louisiana. I cannot tell you when that's going to be and exactly what we're going to experience between now and then. But what I can tell you, and I have no doubt that I'm right when I say this, is that the extent to which people engage in the precautions that we have encouraged them to follow, we will get through this with the least amount of spread and disruption, and in the least amount of time. In closing, I would like to make an announcement about tomorrow in the morning. We're going to be joined by the United States Surgeon General, Dr. Jerome Adams, for a meeting about our response to COVID-19 here in Louisiana. We're going to be giving him updates on the situation, and I'm glad that he is coming. It's actually, this trip has been in the works for several weeks, long before the COVID-19 situation actually came about. But we're going to take this opportunity in order to interact with him and give him a briefing on what's happening here in Louisiana. This will include a number of local officials and healthcare stakeholders from around the state of Louisiana as well. We will have a joint press conference tomorrow morning after that meeting, and my office will have more details about that press conference later tonight. So I thank the Surgeon General and the federal officials who provided information and support to the state. Tomorrow's discussion is going to be important. Today, I have been in contact with Dr. Brett Gerard. He's actually a Louisiana native. He's the Assistant Secretary for Health and Human Services in Washington. And I've been in contact several times with Vice President Pence's office. At this time, I'm going to ask Dr. Bu to come up, provide more details. At the conclusion of that, we will take your questions.
Thank you, Mr. Governor. Thank you all. To reiterate some of the information that the Governor just shared, as of today, we added 7 new individuals with COVID-19 for a total of 13 currently identified as presumptive positive cases in the state of Louisiana. We are sending samples to the CDC for their confirmation, but we are confident in our tests and believe these are individuals with COVID-19. And our team in the Office of Public Health and at the Louisiana Department of Health is working with healthcare providers, the individuals, and their close contacts to quickly identify individuals who could be at risk for having come into contact with those individuals, and ensuring that they're getting the proper messages about how to take precautions for themselves, and again, take steps to mitigate the spread or slow the spread of COVID-19 in our state. As the governor also said, we do believe, given that the majority of cases that we have so far are in Orleans Parish, several of which, most of which, don't necessarily relate to each other, that we do have community spread, at least in the greater New Orleans area. The most important thing that people can do with that information is be sure to take the advice that you just heard. And that's cover your cough. If you are sick, you should be staying home, contacting your healthcare providers, where they will talk you through an assessment just as they would any other time. We should all be washing our hands frequently, and that goes for the entire state, not just the greater New Orleans area. And thinking about how much contact we have with older individuals, our loved ones who may be older, or friends and family, or individuals who are ill, have chronic conditions, especially lung conditions, conditions that affect their immune systems, to make sure that we're not putting people at risk for transmission, for acquiring this infection. One thing to stress, what we have learned from the global numbers and data that we have about this epidemic is that most people have relatively mild symptoms. 80% of people have mild symptoms related to this infection. Our steps that we're taking now to slow the spread is really focused on keeping it from those individuals who would be at highest risk for more severe symptoms. And that's why you hear the steps that we're talking about: travel limitations, contact limitations, limitations in going to events, especially for older adults and individuals who have chronic infections or chronic conditions. That's also the reason that we, in collaboration with the New Orleans Health Department, since last night have been working very closely with the Lambeth House, where we do know there would be increased concern for those residents and the potential for many of them being vulnerable to more severe effects of COVID-19. We are really pleased to say that Lambeth has been nothing but supportive and a clear partner with their clear communications today, so that we really can assess that situation in collaboration and really in support of the New Orleans Health Department as quickly as possible. And so again, we will continue to update the public, as the governor has said, and as we continue to commit to, with twice daily updates of the LDH website, so that you will know presumptive cases as we have them. We're also continuing to work very closely with healthcare providers, community leaders across the state, across our whole government response to coordinate their preparedness and response activities as well. So with that, thank you very much.
Okay, so we're going to take some questions. Yes, sir.
First, we go through the list of parishes impacted, and secondly, we field a lot of questions in our newsroom concerning whether or why public leaders won't say what hospitals specifically these patients are being treated in. Is there a reason for that?
Well, there is a reason. We have federal laws that we are trying to adhere to, obviously, and they prohibit us from giving certain information that would not only identify a particular patient, but perhaps allow for the identification of a particular patient. Having said that, I do believe that going forward, we are going to give information about particular hospitals, not any identifying information about the patients themselves. And I think the first question you asked were about the parishes. So the parishes are Orleans, Jefferson, St. Tammany, Iberia, Lafourche, and Caddo. Now, when that list of parishes we put out as being impacted, meaning that either there is an individual from that parish who's presumptively positive, or they're being hospitalized in that parish, or potentially both. So that's the what we're trying to communicate when we give that list. Yes, sir.
Governor, in addition to the 13 positive cases, how many tests total has the state administered since?
Oh, well, I'm going to ask Dr. VU to come up. Obviously, the testing has been ramped up. When he gives you the numbers, though, I do want you, first of all, the number of tests for individuals who are meeting the testing guidelines that we're getting from CDC, that number is increasing. But the biggest number of increased tests are for what we call surveillance testing. And so it gets pretty complicated. I shouldn't even try this. But you have a plate with 122 wells. We're not testing that many people who meet the CDC guidelines at any given time. But once you run the test, because of the limited reactive agent and other things, then those wells cannot be tested again. So what we're doing is we're filling those wells with surveillance samples, meaning someone may have come in and been tested for the flu, and we have a sample, and so we're doing surveillance. So I'm going to ask him to come up and tell you about that, and he'll also tell you about the fact that we've recently received additional test kits as well, so that our testing capacity is being increased.
Thank you. So when it comes to testing, we are testing almost around the clock at this point. So those numbers are going to change hour by hour. I don't have the exact numbers. That's why we wanted to simplify things by making sure that what we think is most important for the public to know are those individuals who are being identified as presumptive cases, as well as individuals who are being identified as people we were concerned about in the first place. They're called, as a term of art, persons under investigation. As the governor noted, we are taking efforts to make sure we have an adequate supply of test kits in state. The federal government's been very generous in supplying us, and we haven't had any challenges there. And we continue to try to expand to meet the demands of increased testing. And certainly, I think with the first case and now at this point with this number of cases, we are seeing more and more testing happening. So it changes so fluidly. We're trying to make it simplified.
Question for Alex?
I think
You
so.
can stay up here.
Trying to get off stage.
On the subject of testing, now that you've determined there's community spread in Orleans Parish, has that changed how you're testing and who you're testing?
So we're looking at that right now. We've been in communication with high-level leadership at the CDC twice today, looking at ability to expand the testing that's happening in our state labs. It's worth me reiterating that there's also access to commercial testing in the state. And their criteria may be slightly different from ours, but we are looking at not only how to adjust our criteria, but how we can make sure that we're really serving the capacity that we're seeing from, the demand for capacity that we're seeing from New Orleans.
Yes, sir.
Governor, given the residents of the Lambeth House are presumably more at risk, given they're elderly,
Yeah.
is LDH testing every resident there? Can you talk specifically about what your LDH is and the state is doing at Lambeth House?
Yeah, when it comes to testing and what's happening at that facility, Dr. B is going to answer that question. But your first point is one that I want to reiterate. The older population is the one that is most vulnerable, most susceptible to having serious adverse consequences from contracting this viral infection. And those who have underlying chronic health conditions, as Dr. B mentioned. And certainly that goes for older people who have themselves underlying conditions. But the response as it relates to testing with respect to Lambeth House, I'm going to ask him to respond to that.
Yeah, and so similar to what we do with other outbreaks, what we're really trying to do immediately is find out who might have come into close contact with the individuals that we've identified to be presumptive positives. In this context, we're looking at the entire facility and trying to identify what was the risk. I'll note, Lambeth House has multiple wings, and so what was where were these individuals from? Are there potential exposures to different wings? What I can say at a high level is, if somebody has been exposed to a case and has symptoms, they will be tested. If somebody has been exposed to a case and does not have symptoms, they would go into isolation and self-monitoring, meaning we would be checking their temperatures twice a day or advising their temperature be checked twice a day and looking for other symptoms. And that doesn't just go for the residents, but also for people who might have come in contact and worked with them, workers at the facility as well. Same thing, we aren't currently, and the CDC and federal government are pretty clear that testing of people who are not showing symptoms is not currently a recommendation because the test is not designed to test people who do not have symptoms.
Just one more question. It's spreading across the state now. Can you talk about the significance of seeing it in different parishes? Is that worrisome to leaders?
Well, I think you can answer that question. Yeah, it is. We would obviously prefer that that not happen. And so that's why we're issued a statewide emergency declaration today. That's why we're asking everyone around the state, regardless of where they live or work or where they happen to be visiting right now, is that they all follow these precautions. And it's first of all, it's important because it will reduce your risk of exposure, but it's also going to reduce the risk of spread to others as well. And so it's just something that's critically important. And it is worrisome. Again, we want to make sure people take this seriously and that they heed the recommended precautions that are being given. We don't want people out there who are overreacting to this in the sense that maybe they're engaging in conduct that is not helpful, that is and so forth. And so trying to communicate the right sense of urgency is always difficult, but we do the best we can, and we're trying to be as transparent as possible and as timely as possible with accurate information so people will know what's going on. Yes, sir.
Governor, so when you said about urgency in regards to Orleans and Jefferson Parish, we talked about those numbers, but you've seen a couple of college campuses have already converted to online classes. I mean, do you think that's an overreach, or do you think that's a good precaution?
No, well, first of all, if they have the capacity to deliver education online and minimize travel and personal contact, then I think that is something that is smart. We are seeing, I don't know that they've made the transition. I think they've announced dates by which they intend to make the transition, just so I think we're communicating a little more clearly about what the facts are. But that is something that they were asked to consider. They were given information that would form the basis of that request. They then evaluated what their ability to deliver via distance learning was and have opted to do that. And so yeah, I think that's important. Everything that we can do right now to minimize the travel and the unnecessary contact and so forth, I think can be helpful. Again, we're trying to make sure that the peak that we hit is as low as it can possibly be, and that we spread the duration of this out over a longer period of time so that peak demand doesn't hit and deplete our capacity to deliver health care. So anything that they do in that regard, I think is helpful, and I appreciate their cooperation.
Okay. One more question. This may be a better question for Doctor. Based on the models that you've been looking at, do you have an idea of when you think it may peak? Days, weeks, months? It's kind of uncertain at this point.
We really don't.
Yeah, I can tell you, we can't even engage in that kind of guessing. Okay, it just wouldn't be helpful. Yes, sir.
Governor, I know that you got UNO, Tulane, and Loyola who are now going to online class, a little bit smaller universities. Any update on if LSU or any of the larger universities will be moving to that course? Have you heard anything?
No, I don't have an update on that, but as decisions are made, they will be announced timely. And again, I think that the announcements that have come have been about a transition to online education at a later date. And so it's not like these things are going to start tomorrow. Yes, ma'am.
Governor, in some states we've seen officials say that they are recommending against any gatherings that are 5,000 people or larger, and I know that Mayor Cantrell has canceled some events that were scheduled in the coming days in New Orleans. Do you think that's an appropriate reaction to start canceling these kind of things, and do you have guidance that you're giving local officials in that regard?
Yeah, so as I understand it, it's not just Mayor Cantrell, but she has more than one, and I'm not sure how many events she has ordered to be canceled, but that also happened in Jefferson Parish today with respect to some parades over the weekend. And it's not just government officials, as I mentioned a while ago, the NCAA taking a look at guidance from CDC, and I know that they work directly with the U.S. Department of Health and Human Services and CDC and so forth. They've made some determinations in this regard. So I am certainly not going to be critical of those decisions, I will tell you that that was the subject of conversation that I had with Dr. Gerard today, was trying to get the very best guidance from Health and Human Services and the CDC about those factors that should be taken into consideration in making decisions about events and gatherings and so forth. And that's why I can tell you that as this goes forward, there will be more announcements, as I mentioned in my prepared remarks. And unfortunately, that's just the way that this is going to play out. Yes, sir.
And I know, Governor, kind of following up on the university question, a lot of students have been telling us that they maybe don't have laptops to do the homework or the courses at home. Are y'all have any plans to assist them with that, or what would you recommend kind of the university do for those students?
Well, you know, this is all fluid. It's happening quickly. These are the things that are being taken into consideration by the higher education leaders who are making the decisions about when and whether to transition to online education. And if I went beyond that, I would at this point be guessing. I don't want to engage in that. I will tell you, I have confidence in higher education leaders in Louisiana, both public and private. And when they make a decision, I believe that they will be able to implement that decision, and it will be in the best interest of their students and the public. Yes, sir.
Right now, traveling is a concern, and many people right now across the country are taking advantage of cheap flights. Do you think those people are putting themselves in a risky situation by doing that?
You know, I'm not going to say that people should stop traveling. I will repeat the guidance we've received from our federal partners, and that is if you have symptoms, if you're sick, you shouldn't be out traveling. The older you are, the less you need to be out traveling, and it needs to be a very essential trip for you to make, and that's with respect to airlines. And under no circumstances, if you are old or have one of these underlying health conditions, presently should you be considering getting on a cruise ship. And that doesn't come from me. That comes from Washington, D.C., and I'm just trying to amplify what that guidance is. Yes, sir.
Governor, you've said about 80% of cases, people experience mild symptoms. Can you give us a sense for whether any of the 13 cases in Louisiana have risen above that level to a severe case?
Yeah. I have said that before, but he said it today. And really, I'm not, first of all, that is a good thing. And it's a good thing that 80% have mild symptoms, that many people who are presumptively positive and then confirmed positive will not need to be in a hospital. We also know it's a good thing that very few really young people are having any real impact from this. But with respect to how many of the 13 presumptive positives are on the mild side, is that what you asked?
Right, or if any have risen to more severe levels.
I think I'm going to let Dr. BU answer that to the best of his ability.
Yes. So I think the easiest way to answer that is I think almost all of these individuals have had to be hospitalized, and so that we would classify as having a more severe illness.
Yes, sir.
How many kids do we have right now to test the coronavirus here in the state of Louisiana? Are we getting more possibly in the future?
And did you say kits or kids?
Or is it kids?
Kits. K-I-T-S.
Yeah, I
Okay.
think that's it.
I'm sorry. I thought you were asking about kids. I'm going to ask Dr. BU to respond to that too, because we recently received multiple kits from our federal partners. Before that, we had received a kit that had 1,000 wells in it. Then we received 2 kits of 500 each. But most recently, our capacity has been ramped way up.
Yeah, and again, it's similar to a question about testing. It's fluid, so I don't know how much of one kit we've used versus another. What I can say is, since we began to get kits shipped by the federal government, we've had a total of 23 kits sent to us, and the last set we put in a large order, and within 2 days that was received by us. So far we've had no signs that the federal government's having any difficulties in getting us kits as we've expanded our request for capacity.
Governor, you mentioned earlier that people can self-isolate themselves at home, of some of the not victims, but some of the people. So is there regulations for that for those people? Yeah. Are they allowed to go into big spaces or what?
No, isolation means isolation. So there are individuals who will be presumptively positive, who do not require hospitalization because their symptoms will be relatively mild. And rather than have those individuals placing another demand on our healthcare providers, it's not our decision. This is guidance from the federal government that they rather would be better off at home. But they do have to isolate, and we do stay in constant communication with them at least twice a day for the period of that isolation. And so that's, I think, what we were alluding to earlier. Yes, sir.
Can you speak to the department's capacity to investigate some of the community contacts that people who've been infected? And is there going to be any effort to hire more employees to do that type of work?
Yeah, and that's a conversation that we had earlier today, and I'm glad Dr. BU is here because he knows more about that and is up to date. But if you were talking, so these are those epidemiological investigations and contact tracing, which I think is the same thing.
Mm-hmm. Yes. So, we have a team that does this work of contact tracing for all sorts of reportable infections all year round. That team is really who's front and center right now, taking those calls from providers, allowing those tests to be performed, and then also following up these presumptive positive cases, really identifying who's come in close contact with them since they were symptomatic. So they're working really around the clock. We've recently moved staff within the Office of Public Health to augment that team. We've also been working, especially because of the number of cases in the New Orleans area, with the New Orleans Health Department, who also has some capacity to help with that contact tracing. And then most recently, we've been speaking with our federal counterparts and have asked and been answered that we receive some support from federal CDC staff to come into state as well to augment that team. It's a really critical role, but we're also a very generous and gregarious people, so we have lots of contacts, and that means lots of people for our teams to be making notifications to and learning more about.
How many federal investigators are going to be coming in to augment the state staff?
So I don't have those specific numbers at this time.
This is for the doctor as well. How much work do you have to put in to do just one contact tracing?
Well, so not being a contact tracer myself, I want to caveat that there's an entire specialty here for these epidemiologists, these disease investigation specialists. But I would need to have a conversation with you and ask about how many people. First of all, when were you first symptomatic? How many people have you come into close contact? Relatively like 6 feet or so in close contact. What was the nature of that contact? And we're going back for days. So really think about if you had to go back a week and think about all the people you've come into contact with, in close contact with. We take that information down. Then we need to reach out to those individuals, and it's sort of a spreading ring of making sure that we get to the point where we know who has no symptoms and just needs to monitor.
Okay, so we'll do one more question. Yes, sir.
Of course, tourism is a big part of Louisiana's industry, and New Orleans, of course, has 2 big music festivals coming up. My question for you is, when we're looking at situations about where we should and shouldn't be doing things, is it more the demographic of people who are going to be out there, or is it the quantity of people who are out there?
Well, I think it's not either or. I think it's both, and you have to look at what's going on the ground. You have to figure out where people will travel from in order to arrive at the location of the event and those sorts of things. But you're exactly right. I mean, tourism is incredibly important to our state, to our country, and the biggest tourism market we have in Louisiana happens to be in the New Orleans area, as you know. It's obviously going to be a negative impact to the economy that we won't have spectators in the arena when they play the Women's Final Four, for example. Look, the economy is incredibly important, and I don't want to understate that at all. But these are decisions that are being made in some cases by government officials at the local level, in some cases by NCAA officials in consultation with government officials that are designed to minimize the risk of spread and minimize the demand on healthcare providers. And so these are very, very tough decisions to make, and nobody's going to do it lightly. And I guess the easiest thing in the world would be to find fault with a decision and so forth. But you know, I'm gonna, and you asked specifically about tourism, so I'm gonna ask Lieutenant Governor Nungesser to come here because he is the state's chief officer with respect to tourism. He can give you all the latest numbers and share with you his views on this as well.
You know, it's difficult. The safety of Louisianans is the most important thing. But it is the fourth largest industry. 51.3 million people came to Louisiana last year. And this is the time of the year where the restaurants, hotels make that money to help them through the summer when some don't survive. And so over 400 fairs and festivals are planned around the state. And many of those decisions will be made by the people. Jazz Fest, for instance, owned by a group out of California. They will make that decision. Right now it's still on. French Quarter Fest is a local event. I'm sure the mayor and those coordinators will make that decision. We're trying to do everything we can to give people the comfort level to eat in the restaurants, to healthy people, and to do it with caution because we want to support that industry. We've asked Louisianans that are healthy to staycation here in Louisiana and go out and support our businesses because it is very important to the industry and will have a long-term effect because of this horrible virus.
But thank you. So, as we mentioned, we will have a press conference tomorrow morning following the visit with the U.S. Surgeon General. I want to thank you for coming out tonight and appreciate your patience. And again, I want to thank this team who's up here, all of whom are working extremely hard. And this is a very serious situation, as you know. I think the Lieutenant Governor put it perfectly. The health, safety, well-being of our public is the number one priority, period. So thank you all.